in physical therapy at Columbia University in 2017. I've been practicing since then, and I spent 5 years working at Stanford Hospital before moving to India, and I have been here for about a year, a little over a year now. So this is just a good slide to talk about different reasons why somebody might want to see a pelvic floor physiotherapist or a pelvic health physiotherapist, or especially just somebody who has experience treating postpartum. There are various reasons, right? So for example, like somebody's come and told me that I really want to get back to Zumba, but I'm scared that I'm going to leak urine because it's happening when I cough and I laugh, and I'm scared that it's going to happen when I start dancing or jumping. Or my back started hurting during pregnancy, and I thought it would get better after I gave birth, but it's just getting worse. And a lot of times it's my body just doesn't feel like it's me anymore. And it's been 2 years since I've given birth. So, people just kept telling me like, it's just gonna get better, it'll be fine, give it time, and I still don't feel like myself. So would all of these moms benefit from a physiotherapy consult? 100% yes. So a study in 2018 actually showed that up to 87% of women reported positive effects of physio treatment for their pain. And that's a really, really high number. So it's just important to note that if you are experiencing pain, leakage, if you're not feeling like yourself again, difficulty, and we're going to go over a lot of these things, but a physiotherapy consult and some physiotherapy treatment is shown to be highly effective. So, what does a physiotherapy consult that's geared towards women who have had birth look like? It's not going to be like your average physiotherapy consult that you go to when you go to a sports physiotherapist or orthopedic physiotherapist, right? I would say it's very different, and we're going to go through what that evaluation looks like today. So this is an example of a report that somebody gets after they go through a postpartum physiotherapy evaluation consultation with us here at Proactive for Her. And then we're going to kind of break up each of these sections and talk about why we're looking at the things that we're looking at. So we'll keep going here. So we always start with asking about your history, right? I think it's really, really important to give everyone their time and the space to tell us what you've experienced. I think a lot of times practitioners don't have the time, and thankfully at Proactive, all our practitioners have plenty amount of time to actually hear you out and listen to your concerns and listen to your history thoroughly, because there's a lot of information there, especially if you've given birth, right? So we want to talk about not just how you're doing today, but also like, what was your fertility journey, right? Was it that you had a really easy time getting pregnant? Maybe you had an unexpected pregnancy, or maybe you had to go through, infertility treatments. And then what was your pregnancy like? Or also, is this your first pregnancy? Is this your second pregnancy or third, right? And then what kind of symptoms did you have in pregnancy? Were things really smooth sailing, or did you have complications, or did you have back pain? Did the leaking start then? So, we really want to take a deep dive into that. And then we also want to hear about what was your labor experience and your birthing experience like, because that can be either really, really amazing and beautiful, which is awesome. That's what we want for you. Or it can sometimes be traumatic as well, not just for your body, but mentally. So we want to kind of understand what went on there. And then we want to understand what's going on currently, right? What are you experiencing pain? Are you experiencing weakness or difficulty doing the activities that you wanted to do or want to do, but you can't? Do you have any urinary and bowel difficulties? And what does your sexual health look like, right? Because that's obviously important to everyone. And then we do a quick psychosocial screening just to see how are you feeling from a psychological perspective, and do you need somebody that we can refer you out to? Thankfully, within the Proactive Network, we have some great mental health experts. And so if that's something that's needed, right, that affects you physically, and so we want to make sure that that aspect is addressed. So what we really like to do is look at you from a holistic perspective, right? Look at all aspects of your life. And so if you're looking at this chart here, right, you have this health condition. Okay, we can say postpartum, for example. And then, we want to look at what's going on with your body functions and its structures, right? So do you have weakness? Do you have pain? What are the things that are affecting you from just like a physical perspective? And then we want to look at how is that affecting the activities that you do? Okay, so are you able to get up from the floor when you're playing with your child? Are you able to lift your child from the bed or the crib? How's breastfeeding going for you? How about when you're bathing your child? Like, what are you experiencing then? What about if you're, 5 years postpartum and you want to play with your child and, you're having a difficult time, engaging in that. So those are the kinds of things that we want to ask about and talk about, or even cooking, cleaning, showering, toileting. How are all of those activities affecting you? And are you able to do them the way that you want to, right? Then we go into participation. So right here, and that's your participation in recreational activities. Do you feel like you can get in a car and travel if you wanted to? Can you go visit your family if you wanted to, right? How about climbing those stairs in an apartment that's, hard to get to see somebody or see your friends? Yeah, are you getting back to socializing? And is there anything that's physically limiting you or even mentally limiting you from going back and socializing? And then, things like, even like I said, doing recreational activities with your children and your family. So some of those, like what we would say like fun activities, right? Are you able to do those? Exercise as well? And or are you interested in doing it and you're not able to get there, or you're fearful of getting there? Okay. And then we also want to look at like your environmental factors, right? What's your home situation like? What's your work situation like? And is that a good environment, a supportive environment for you, or is that a stressful environment for you? Because that can affect you physically. And then also personal factors, right? How is married life or an unmarried life with your partner after you gave birth? How are you feeling with other relationships in your life or even with your child? And so again, those things will affect your health conditions and your physical conditions. So then we get started. Once we've taken a really good history, a good understanding of everything that's been going on with you and is currently going on, we want to now do a physical assessment. So now what I'm going to be talking about a lot is what happens during our physical assessment. First thing I always look at is what's your posture like and how are you walking? How's your movement, right? Where are you placing your body weight? Because that can affect how your muscles are reacting. So a lot of this image on the left-hand side is basically showing what happens during pregnancy to your body. And there are a lot of postural and walking pattern changes that start during pregnancy, and then a lot of people think like, oh, once the baby comes out, my body will be like back to normal or back, whatever it was. And that's actually completely false. A lot of these changes continue after you've given birth as well. So, just starting from your neck down to your toes, right? Your neck starts to maybe go forward a little bit or back. You might have increase in headaches and neck pain. Your pelvis kind of tilts forward as the weight in your belly increases, right? Because the baby's sitting into your belly and then your pelvic floor. So you might start getting pain around your pelvis, your low back, even leg pain. And then you might start getting a little bit of rib cage because your mid back area here gets actually pushed backwards, right? And then as the baby is growing inside your belly, you might even get some pushback into your heart and your lungs, and then into your rib cage. So you might have a little bit of a harder time breathing. And then, pain in your hips and your knees, and even into your ankles and your feet is pretty common. So as the baby's growing, as you're getting, the changes are happening in your body from a postural standpoint, you're also having changes from a walking pattern standpoint because of that. So you might notice that you started walking with a little bit of a wider base of support so that you can maintain your balance. And then you might have noticed that, getting up from places is a little bit tougher because you have this decrease in your hip strength, and the stability isn't as supportive as it used to be. And then you might even notice that your feet are getting affected because as you're gaining weight and that weight is pushing downwards, you might have a change in your arch support where things have flattened out a little bit more. So then we want to look into what your breathing patterns looks like. So I kind of I spoke about this a little bit earlier when we were talking about the rib cage pushing backwards. But you have a diaphragm, and unfortunately my pictures haven't come in, but basically your diaphragm is a muscle that sits right underneath your rib cage here. And it's a really important muscle that helps you to breathe, okay? So, with pregnancy, you experience changes in your diaphragm and your rib cage because the baby is growing, right? And so you're going to notice that outwardly it's growing, you're getting pressure here, but then it's just looking for space wherever it can. So your things are being pushed up into your lungs and your heart. And then postpartum, these changes in your diaphragm and then the rib cage can play a big role